Hi, I'm Dr. Brett Dyer. I'm a periodontist in Sugar Land, Texas. Our practice is Fort Bend Periodontics and Implantology. This will be in 2019. This will be our 28th year. It's hard to imagine that much time has flown by. I started, I got the idea to become a periodontist. Actually, it wasn't mine. It was, I was at the top part of my class, and the chairman of the Department of Periodontics would come in and sit in with me when I was a student and start doing surgery with me and said, hey, you'd make a great periodontist. And being a kid going through school, that's kind of a heady thing to have a chairman come and sit with you and do surgery and do that. And I kind of bought into it after a period of a year or so. And so graduated from Baylor College of Dentistry, which is actually kind of a tender topic right now because Texas A&M bought Baylor College of Dentistry, and now technically I'm an Aggie. So in Texas, I graduated the University of Texas at Austin as my undergraduate degree. I'm a Texas Longhorn, and they were our chief football rival. And so to have our rivals buy my dental school and make me an Aggie, I just got to live with it, I guess. But so that was 28 years ago this year that I started on that process, or actually a little bit before that. I was in dental school for 4 years, and then I had 3 years of residency. And then I started this practice in July 1st, 1991. Those first few months in practice, I just had a new kid, new child, new son, and my wife and I came out here and started a practice. This is like the ideal field in dentistry, at least for me. I'm able to practice 4 days a week. I'm able to do clinical research. I've been able to work with great companies in developing laser products and implant products. And I get to lecture. I get to teach at the University of Texas here in Houston. And I generally work with a graduate or residents in their thesis projects. And so my job is to mentor them through that process, give them ideas and help them work through the details. And it's an incredible life to get to do this, to practice, to teach, and to lecture. It's fun. I hope to do this a lot longer. Thing about lecturing, especially when you're lecturing to large periodontal groups, lots of periodontists know the literature. And so the biggest advantage of being a lecturer every year is you have to be on top of everything. You have to be on top of the literature. You have to be on top of the latest techniques. And so you always have to be current. You don't want to be caught in a lecture and be found not knowing those types of details. And so I think the biggest advantage of teaching and lecturing is that it keeps you at the forefront. And working with residents, you're working a little bit beyond the forefront. You're working with new ideas, new concepts that are coming up. And that's what generally their research projects are on. And so it lets me keep my finger in all those pies. I think I have a pretty firm history of the past, but the present, it's always changing. It's always evolving. There's no drifting or coasting in this field. There's always so much more new stuff to learn and to be able to do. So actually, it's kind of fun to get to be on the edge all the time. As a general dentist, you can do all fields of dentistry. You're not really limited to anything, but the strength and weakness of that is you get a good comprehensive knowledge. The weakness of that is you're not typically in the cutting edge of any of those fields. So for doing fillings and crowns and normal day-to-day stuff, being a general dentist is great. But the advantage of a specialist, someone like me, is I know all about the techniques for growing back bone, or for growing back soft tissue, or for restoring basically the ability to take a patient who's had some type of loss, whether it's trauma, whether it's infection, and you've lost gum height, or you've lost bone or teeth. I have the training, the technology, and the expertise to deliver a type of care that's a step above what you would get at a general dentist office. Typically, it's when the things that send patients to me most frequently. A patient looks in the mirror and they've noticed that their gums have started to recede. Um, this happens a lot. This morning, it happened to a gentleman who he's had one child. He's about to have another, and he's noticed in between the two children that all of a sudden his gums are starting to recede. So he's been a little worried. He's been clenching and grinding his teeth, and when he looks in the mirror, he can see the necks of his teeth and now the roots of his teeth. And so someone like me, that's not a big challenge to correct. I can correct the underlying cause, and we can repair the damage to it. Other things that patients come in to see us frequently for are gum disease. So I'm a periodontist, and so I'm a specialist in gum disease and dental implants. And so in a traditional dental office, a general dentist office, if you have gum disease, they'll do deep cleaning around your teeth and try to get a mild case of gum disease under control. Some of them even use early forms of lasers, the diode laser, to treat early forms of gum disease, but they don't typically have the expertise and the technology to repair advanced bone loss or even moderate bone loss. And so if you've noticed that your gums are receding, but also maybe your teeth are loose, or maybe you have bleeding around your gums are bleeding a little bit, or you have a family history of gum disease, or you have heart disease or diabetes. All those things tend to predispose someone to having gum disease as well as those diseases. And someone like me can restore the gums back to health and actually lower the risk of heart disease and decreased blood sugar in a patient with diabetes. So coming to someone who has that level of treatment available to you is something that can really not just affect your teeth and your gums, but your overall health. It starts off as it does in every office with a doctor and a patient. We try to get to learn our patients' concerns and their needs and their desires. But when you start with me, at least in this practice, our goal is not only to get you healthy again, but it's actually to keep you that way. And so I have lots of patients that have been with me for 10 and 20 years, and so they become a friend of the practice or a friend of the family. I've seen patients grow up, and I've seen patients age, and have taken care of them through the whole process. Primary services would be we do a lot of laser regeneration procedures. So that's if you've had gum disease and you've had bone loss around your teeth, you've probably had an aunt or uncle or some type of relative that's had traditional gum surgery, and after they had their treatment, their teeth were longer and their teeth were sensitive, and in 3 to 5 years they had to have it done again. So the difference between that and what we're offering in the office is laser regeneration. So with laser surgery, there's no incisions with the scalpel. There's no bleeding or very little bleeding at the time of surgery, and no swelling after surgery. And so what that means to the patient is it means if you don't have swelling, you don't have pain. And because the laser incisions are so small, it's such a minimally invasive procedure, you don't get recession after these procedures. In fact, we typically correct it. And so the experience is so much different. With a traditional type of dental surgery, you're going to be recovering from that type of procedure for a week or two. And from a laser type of procedure, it's hard to tell where I've done surgery the day after I've done it. And so it looks better, doesn't swell, and there's not pain associated with it. And so that's a huge advantage to using lasers, especially the cold lasers, or the lasers that don't create damage in the soft tissues. Other typical procedures for us every day are we do something called the pinhole surgery, which we do this every week, several times a week. And that's for patients that have had gum recession, and maybe they know someone, or they've even had themselves, this happens all the time, they've had some type of connective tissue grafting done in the past and it failed, or the results weren't quite what they wanted. And that type of procedure, the tissue's harvested from the roof of the mouth, and then it's placed somewhere where there's gum recession, and the wound healing from that is pretty extensive. With a pinhole procedure, all the surgery is done through a pinhole, so another minimally invasive surgical procedure. And typically, we'll have the patient come in 24 hours after we do the surgery. And it's not unusual for a patient to have taken Advil the first day, maybe the second day, and that's all that they're going to need. You can see your results starting immediately after surgery. So it's a minimally invasive, it's not painful, and it's just the next stage in successful grafting today. Other procedures we do quite a bit of are dental implants. We place around 400 or so a year, and so if you're missing one tooth or several teeth, today we can replace those teeth with dental implants. And if it's in the anterior area, we typically can replace the teeth and put temporaries on there the same day. If it's for posterior teeth, then typically we replace the implant and then the crowns would be placed later. We work with a lot of referring dentists in this area. And so we don't do the crown portion of the teeth, the final crowns. We'll do temporaries and things like that the day of the surgery. For the final restorations, we'll either send you back to your general dentist or we'll refer you to a general dentist that we work with. And so grafting, regeneration, dental implants, those are really common procedures in our office. We also treat a lot of headache patients. It seems like today stress is an aspect of everybody's life, and lots of people are taking pills every day to control their headache pain or tension pain in their joints or around their ears or right in the temples or behind the eyes. All those areas that you would get a headache are stress headaches most of the time. Even migraine headaches. Migraines tend to have triggers that set one off. And today we do a lot of treatment for headaches, migraine headaches, with both physical therapy, also using Botox. We'll use Botox to relax the muscles of the face and then the head and the neck and shoulders. We'll use different types of appliances to make it where you're not clenching and grinding so hard. And a combination of all those approaches to eliminate those problems for patients. Today, you do have a lot of choice. There's a lot of corporate dental offices in America today, and especially in Houston, the greater Houston area, and a lot of traditional insurance practices, and they tend to be limited by the insurance plan. They offer you just what insurance will pay for, and so you get treatments like traditional osseous surgery. It's been on the market. People have been practicing it since 1949, and it hasn't changed a great deal. And so today, still the most common surgery you would get in a periodontist office is osseous surgery with a scalpel, and you end up with gum recession, you end up with tender teeth, longer teeth. There are true advantages to having treatment done with modern techniques in a minimally invasive format. And on top of that, it's not any more expensive than you would get if you went to your practice. It's an all insurance practice, and in fact we take all insurances, but we have this technology, we have this expertise to make this experience where it's not something that you're going to dread before, during, and after.